Hello to you all. Good morning, good afternoon, good night, and some other variations on that because you're spread across the world, as indeed the speakers are today from 5 continents, as it happens. This is the first time that PCST has tried such a meeting synchronously across the globe, practically. And it marks a particularly significant date because, as you know, I guess at this stage, we should have been meeting physically, face-to-face in Aberdeen in Scotland on this day and indeed all of this week. For reasons that are by now very familiar, we're not doing that. But I have very good news to give you. As of today, just 2 hours ago, we have that the arrangements between the University of Aberdeen and the conference venue have been sorted out, which were in some doubt and unclear for the last 2 months since we rescheduled the conference or postponed the conference. And we now will be going ahead in a year's time exactly. So this day, 365 days from now, we will be meeting in Aberdeen. So it's nice to be able to confirm that is the case, and you are the first people, bar 2 or 3 others, to hear this piece of information. The webinar today is held with that May 2021 conference in mind, because obviously the agenda for that conference has to take account of the absolutely enormous events that we are facing across the globe. And what their implications are for science communication. And these are obviously very considerable indeed. So the webinar has been organized in the hope of raising some questions and stimulating some ideas and reflections, and indeed some research that might then be presented in a year's time at the conference in Aberdeen. So we're not presenting finished pieces of work because it's too soon indeed to reach any definitive conclusions about the issues that we'll be talking about. We'll be advancing some questions for further research, some lines of inquiry. And I hope, even if it's not today, it might be over the course of the course, that we can consider some topics for cross-country studies, using the PCST network as a platform for connecting people to look at similar questions or comparable questions in different cultural, political, geographic settings. Maybe we'll have a chance to come to that. We are running this for 1 hour and 1 hour only. We will be sticking to that, and the speakers are tied to very strict time limits. Also, we'll ask you in writing questions to us via the Q&A function on the middle of the bottom of your screen, to write questions in a 1 or 2 sentences at most, brief, rather than trying to make long statements. So Q&A is enabled for all attenders. The chat is enabled only for the speakers, the panelists. And the chat we will use to talk to each other about questions that are coming up. At a later date, we'll ask you to give some feedback on this experiment, because it is an experiment for us. Obviously, many of us are having to learn very quickly to do things remotely that previously we always did face-to-face. But be patient, please, because we are new to this, relatively new to this. Be brief, and we will draw things from this webinar to frame a call for proposals, which we will issue in weeks or months for proposals to be submitted for eventual presentation at the conference in May 2021 in Aberdeen. And I should have introduced myself. I'm Brian Trench, and I'm president of the PCST network. And my big thanks go to Jenny Metcalf, chair of our program committee, who is managing all of this behind the scenes and possibly will make herself visible at a later point in proceedings. But first, we will hear from Matt Nisbet, who is in Boston. in USA. He's professor of communication at Northeastern University, and he's the immediate past editor-in-chief of the journal Environmental Communication. Matt, you've been looking at differences in the framing of pandemics and how that's playing out in both US and international debates over flattening the curve, as the cliche goes. And you have advocates for various kinds of solutions, technoscience solutions, such as rapid development of a vaccine or retroviral drugs. And then you have people emphasizing the need for public health systems. You've got the confusion coming out of the White House, and indeed in other governmental centers. So Matt, over to you.
Sure, thanks, Brian. So in my own work, looking at climate change as a wicked problem in a book that I'm completing with my friend and colleague Declan Fahy, we've been looking at the sort of the historical clash of ideas over issues like climate change and pandemics. And as we were wrapping up the chapter on pandemics, the COVID-19 pandemic started up. So it was very interesting to try to trace from what we had worked on in the chapter to how things are being debated today. So historically, there's been sort of two competing discourses about what kind of problem is a pandemic and how to approach it or how to address it. And the one discourse that goes back about 30 years and is embodied probably most prominently in the writing of Laurie Garrett, who's a US journalist who's been covering pandemics since the 1980s, first writing for Newsday, and in the most recent years she's been at the Council on Foreign Relations, and she's written two massive books that have gotten a lot of attention over the last 20 years. One is The Coming Plague, and the other one is The Betrayal of Trust. And in her writing and her public intellectual work, she's defined pandemics as mostly a problem of international cooperation and preparation and investment in infrastructure, public health infrastructure, the public sector, public spending. And unfortunately, that discourse or that approach, as she's written about over the years, has been very difficult to be taken up by the US government and other governments because of the increasing shifts since the 1970s in what critics call neoliberalism and sort of the privatization of the public sector, the individualization of society and the movement of markets into almost every aspect of life, including the public health system. And because of that, in part, because of that, there's been a rival discourse, and that discourse is chiefly embodied today and also has been invested in in several $1 billion over the last 20 years by Bill Gates, the founder of Microsoft. And that definition of a pandemic as a problem is that it's essentially an innovation problem, that the best way to approach the threat or the current threat of pandemics or the future threat is to invest in systems and development of vaccines and drug therapies and treatments, and also in things like disease modeling, epidemiology, and also contact tracing and isolation of those who were infected. And out of that innovation approach, primarily, even though attention to pandemics has sort of spiked in news attention, first around SARS and around swine flu, and then more recently around Ebola, and there'd be these moments of 4 or 5 months where pandemics might be one of the top tier issues in news coverage. In the United States, at least, pandemics has always been thought of as a third world problem, something that's happening in Africa or in Asia, but that because of the US's geographic isolation and because of its assumed sort of modern society and public health sector, that the US was really not a threat, despite the 1918 Spanish flu that killed several 100,000 people, or perhaps more here in the United States and much more worldwide. So as we're seeing the COVID pandemic play out here in the United States, you see these sort of two competing discourses. And unfortunately, the innovation discourse remains the dominant discourse. That's in part because that's really the approach that the Trump administration is pushing. So you see a news coverage in part dominated by the focus on the quest for a vaccine, what will be the timeline to a vaccine. In many cases, from my perspective, a sort of a hyping of the potential of that vaccine and closing down the likelihood, or over-promising the likelihood of an availability of vaccine within even 12 months or even 18 months, when in reality it will take at least a few years, maybe 5 years, maybe we'll never have a vaccine. And then a very heavy focus on other techno approaches, such as tracing and tracking via apps. Obviously, the domination in news coverage in the visualization of epidemiological models. Often these models don't take into account things like economic trade-offs or other health costs of things like social isolation. These models are coming out of the public health sector, and they're not well connected to taking into account social and economic factors in their projections, and also how they communicate the results to decision makers and policymakers. But overall, from the Trump administration, what you're seeing is a prioritization of the development of vaccine over any type of sort of reinvestment or renewed investment in public health infrastructure. The real weakness that we're seeing in the United States, and it's gotten a lot of international attention, is this lack of infrastructure, this lack of preparation, the privatization of our healthcare system, the lack of coverage for many Americans, and the huge disparities based on income inequality and other social factors in how the virus is infecting low-income Americans, which tend to be disproportionately people of color. And the other thing that we're also seeing is also this lack of infrastructure in how we care for our elderly. You're seeing something similar in parallel in the UK, and it's not surprising that you're seeing both of these types of trends happening in the UK and the US, since these are the most liberalized economies. Now, on the other hand, the strength of a liberalized economy is that it might be overtaken by a threat like COVID-19 initially, but it might be the type of economy or society, at least here in the United States, that might be able to turn around and respond the fastest, or at least that's the theory, or what some conservative intellectuals are arguing. And you see that in the quest for a vaccine now. And the danger is in sort of the double-edged sword of the quest for vaccine in the US is if the US is the first to reach and have and to be able to deliver a vaccine to 300 million Americans, then it will reinforce the innovation model. And it will dampen the ability of people who are saying, no, this is a broader sort of macro social problems, and people advocating for proposals like the Green New Deal in terms of sort of widespread societal reform and the need to build out the public sector. It will weaken their case because much of the public focus will now be, okay, we have a vaccine, let's focus once again on trying to jumpstart the economy and go back to so-called normal. And it will also boost Trump's re-election case the quicker it seems that we're able to get to a vaccine. If they are able to pull off what most people would consider a scientific miracle and having a vaccine close to be ready by the end of the year or the next year, that will really bolster Trump's re-election prospects if he can claim, as he calls it, Operation Warp Speed has been successful. So, and again, out of all of that, what you're seeing is science being hyped, it's being distorted. And I think ultimately it will also have spillover effects in how we think about other science-related problems. For example, I think now some of the skepticism, which I think is strongly merited and legitimated about how public health models have been used, people are becoming a lot more familiar with the uncertainties of models and how models are produced. And if they can be uncertain on a time scale, say 3 months, 5 months, 6 months, in something that's a little bit less complex than trying to model the future around climate change 100 years out, I think some of that skepticism and a lot of attention, not just from conservatives, for others, will now start to be focused on claims that are being made about catastrophic climate change happening 75, 80 years from now. So I'll stop there. I'll hand it back over to Brian. There's Brian.
Brian, you're on mute.
Now I'm back on. Thank you very much indeed, Matt. Very interesting, big, broad view. Okay, slightly, obviously, influenced by being in the United States and observing up close what's going on in the United States, but I think with implications for the rest of the world. I'm not going to, I think, give you immediately a question to consider, but hope that others will come in from the attenders and move on, if you don't mind, to Marina Joubert. Dr. Marina Joubert is in the Stellenbosch University in South Africa, where she leads research and teaching in science communication. And she's looking at the case of a medical scientist who has become very much the central figure in the playing out of the debates and issues and policies and so on around COVID-19. We obviously have similar figures in other countries: Fauci in the United States, Roberto Burioni in Italy, and in Britain a whole number, a considerable number of university scientists and government advisors are become household names. But Marina, tell us about the case of Salim Abdool Karim.
Yes, good afternoon, Brian. I'm delighted to be a part of this panel today, and I look forward to sharing some of my thoughts. I'm going to start sharing my screen just because I would like to share some of the media clippings about this specific case with you. Now, I think Dr. or Professor Salim Abdool Karim is an interesting case in many ways because he illustrates many of the criteria that have been suggested for effective public communication of science. And I think we can get some valuable insight from analyzing his engagement with the public over the last few weeks. And as you mentioned, this is research in process. It's not finished work, it's sort of reporting as we go. Now, I think if we can understand what makes a particular scientist popular and prominent in the public eye, then it can also help us understand what the public want and need from science, especially during a public health crisis. Now, first of all, Karim has international stature. He's an epidemiologist, he's a health researcher, an AIDS specialist. He has credibility with not only the scientific community, but of course also with the media and with the public. His 62-page CV spans the United Nations, the World Health Organization, appointments at Harvard, Cornell, and Columbia. He's a member of the US National Academy of Science, and he's also a fellow of the Royal Society. And as you can imagine, his awards are simply far too many to list. He's also well connected. He's sometimes called South Africa's Dr. Fauci, and he mostly just smiles and shrugs about that. But he's quick to point out that they are good friends and that he's able to call on Fauci and, of course, many other top scientists around the world for advice at any time. He is definitely no stranger to the media. Around the year 2000, Karim was one of the scientists who spoke out when Thabo Mbeki, who was South African president at the time, denied or questioned the science of HIV and AIDS. So importantly, Karim faced up to politicians and faced a lot of adversity at a time when he was much younger and less senior than today, but he had the media on his side. And this also made him realize the power of the media to drive policy change. Over the years, he has kept strong working relationships with health journalists and other journalists in South Africa, and he has advocated publicly for science. For example, as in this photo where he joined other scientists in the streets of Durban marching for science in April 2018. I think this photo sums it up rather well. Karim taking center stage in his white coat, but with a megaphone in his hand. Now, he was well known before, but COVID-19 provided the moment for Karim to become a household name in South Africa. Soon after he was appointed to lead a ministerial committee on COVID-19, he participated in a 3-hour televised broadcast, a live broadcast on 13 April. This was, of course, followed by a flood of media interviews, Q&A sessions, and webinars. He was not only willing to engage, but he carved out time for the media. And as a result, he featured in 545 print, broadcast, and online news stories just in April 2020, just in South Africa. Now, I think handling this intense media interest along with his work for the COVID-19 committee must have demanded a specific juggling act, as I think was quite well captured by one of our local editorial cartoonists, John Curtis. If you look at the media cuttings, we see evidence that the public liked listening to him. The journalists also responded very positively. For example, Vuyo Mkhize writes in City Press, on Monday night, he had millions of South Africans glued to their screens, collectively eating out of the palm of his hand. Some took to social media to praise him, calling him South Africa's COVID-19 hero, a man that gives us peace in his explanations. What a grace resource to South Africa at this time, and called him world-class and tagged him, as proudly South African. When Karim talks to the public, it is also clear that he makes an effort to avoid jargon and to help people understand what the science and the scientific advice is about. This is just one example. He's become quite well known for using the analogy of little fires to explain how the virus spreads in communities and how by proactive community testing, we can put out the little fires before we have to deal with raging wildfires later. When he's asked about potential cures, Karim sticks to the norm, the scientific norm of waiting for the evidence. For example, when he was asked about the TB vaccine as a potential protection for South Africans, he said, is BCG helping us? I would love that to be the case, but I'm really skeptical that it has any influence. I will wait for the data to make up my mind firmly one way or the other. I think importantly, he acknowledges uncertainty, and he acknowledges that scientists can also make mistakes. In this quote, he says, whether we're right or wrong, time will tell. History will judge us. I don't claim that we are not making mistakes. If you don't make mistakes in tackling a disease of this nature, it probably means you're not being sufficiently proactive. Now, Karim knows, of course, that the scientific evidence is not always necessarily what the people want to hear. It's not always reassuring. And he does not shy away from hard messages, but I think he tries to deliver them thoughtfully and with empathy, as in this example where he says, our job sometimes is to look at all the bad options and give the least bad one, and then say, of all the bad options we have, this is probably the one we should go with. Here is the scientific evidence for it. When he gives advice, it does seem that he tries not to make it too cold and too clinical. He would express, for example, regret about the new way of life that will be demanded of us when he said, I'm sorry that life is not going to be what it was like before. We're going to have to learn to live in a way where we will lose that soft touch that comes from being close to those we love, for example. And I think you can see in this case how he tries to make an emotional connection with the audience and how he includes himself. He uses the first person. You might enjoy this slide just to make the point that he is, of course, also setting an example by following the regulations that is put to the public. And on the left, also President Cyril Ramaphosa in a number of public settings now have been photographed and been televised wearing a mask as well. Now, Karim has been called a crusader, a revolutionary, and an activist at heart. But now with COVID-19, he has reached a level of popularity in South Africa, which is perhaps starting to approach celebrity status. And so the media is taking an interest in the man behind the scientist. There's been a number of stories in the press about his life, his family, his long working hours, his childhood years, etc. And yes, there's been a few stories about his looks, his charisma, his voice, and his smile. And so maybe this also made me think about it, that perhaps we should not ignore that elusive X factor when it comes to what really helps a scientist to connect with the public audience. I think to summarize what I try to show through these examples, that there's a whole mix of criteria required for an individual scientist to build a trust and effective relationship with media and with society. It is a mix of credibility and ability, as well as attitude and personality. I will finish off by just saying something about the fact that a high public profile, of course, does not come without risk. Karim is obviously not universally liked by everybody. He's had to endure some criticism, which you can expect in a high profile like that. He has been accused of playing into the government's hands by aggravating public fears about COVID-19. And his research funding has also been under rather intense scrutiny, and that is probably a good thing, and he has engaged with his critics. Now this week in particular, Karim finds himself in the middle of a very public and rather adversarial clash between Zweli Mkhize on the left and Glenda Gray on the right. Now Zweli Mkhize is our Minister of Health. He is the person who appointed Karim to the COVID-19 committee, and they have been friends since their years as university students where they studied together in the 80s. Gray, on the other hand, is the CEO of South Africa's Medical Research Council. In 2017, Time magazine named her amongst the 100 most influential people in the world. She's also a longtime colleague of Karim, and she's been on his side throughout the AIDS activism years. So what is the clash about? Basically, Glenda Gray came out quite critical of the government's very strict lockdown strategy, claiming that it was unscientific and that it had devastating effects on the poor communities and children in the country. In response, Mkhize chastised her in the press, accused her of eroding public support, and called for an official investigation into her remarks. Yesterday, the board of the Medical Research Council issued an apology to the minister, so they clearly not supporting her, and Gray has told journalists that she's no longer allowed to speak to the media. So Karim is in a difficult position. He's trying to steady the waters by explaining that robust debate between scientists had to be expected and was necessary to move forward. We are sailing the ship while we are building it, he told me, but he's now sailing on stormy seas, and the next few weeks will show us how he's going to weather this particular storm. Maybe more importantly, how will he navigate the ship now that South Africa's coronavirus infections are beginning to rise sharply, with a peak only predicted for October this year? And last but not least, will he be able to maintain public trust if some of the grim predictions for COVID-19 in South Africa becomes a reality? There will no doubt be many more science communication lessons to learn along the way. And I definitely intend to keep an eye on the situation. Thank you.
Thank you indeed, Marina. Is it possible that the hero could become anti-hero if that debate about the restrictions takes a certain course?
Yes, certainly, because many academics in South Africa have now come out in support of Gray. There's a petition going around that other academics are signing to support her. And Karim hasn't really been publicly seen to, in a way, take sides. So I think it's going to be a very tough call for him, and certainly a high-risk period for his public credibility.
He is also wonderfully telegenic, and that does help if you want to be a celebrity. But there we are. As you say, he's got a great smile and a very nicely clipped beard as well. Let's move.
The one thing that I couldn't unfortunately share with you today is what he sounds like. He really speaks in a very authoritative, deep, reassuring voice, and I think it's something that's hard to measure but very important.
Very good. We'll go back across the oceans to North America, to Dominique Brossard, who is chair in the Department of Life Sciences Communication at the University of Wisconsin-Madison. And you've been working in an interesting setting, Dominique, a broad collaboration between the university, municipalities, public health agencies, and various other stakeholders. And you're bringing science communication research into this collaboration. And how is that working, or with what effect?
Yeah, thank you, Brian, and thank you for the invitation to talk to all of you. It's actually very exciting to know that every part of the world is connected right now for that virtual PCST. There is a strong tradition at Wisconsin. Wisconsin is one state of the United States that has roughly 6 million people, where the connection of the public university to the state is very strong through something that we call the Wisconsin idea. The Wisconsin idea means that the knowledge that's produced at the university level should actually benefit the state, the nation, and beyond, since we have a public land-grant university mission. And so because of this history, there are strong linkages that have been forged over the years between different scientific disciplines and different stakeholders within the state. And I think to go back to what Matt was saying at the beginning, that idea that, the pandemic really should be treated as something that need to rely on collaboration of different disciplines to tackle an issue that's uncertain by nature. What the approach we took here is to define science broadly. So this issue that's being framed, I would say, around the world as a public health issue, mainly it's a health issue, is actually a multifaceted issue. It's actually a public policy issue, and therefore scientific expertise that has to come back in the mix has to be not only from public health scientists, epidemiologists, virologists, and so on in the biology side, but also as social scientists, communication scientists, psychologists, business and economic scientists, and so on, to be able to actually see all the potential dimensions that should be tackled. So at the beginning of the pandemic here in Wisconsin, we had a network that was created of all those broad scientist approach and connection with the Wisconsin League of Municipalities, local leaders that were really worried about the potential consequences of this pandemic, not only on the health of their constituencies, but also on the business health and so on. And so because of that, we started different research projects at the same time with the goal to actually be able to gather data that would be useful at the local level. As a risk communication and communication scientist, my approach was actually to do a statewide survey to try to understand the motivations and barriers of Wisconsin residents to actually apply physical distancing and hand washing and other preventive measures. And based on those, we actually define different campaigns at the local level in collaboration with the League of Mayors to be able to actually, basically like a persuasion campaign to convince Wisconsin residents to follow on that. But I'm just one part of the puzzle. We had social media experts that were doing actually paid advertising campaign on social media. We had computer scientists that were actually trying to see how the best representations of models at the local level with the Department of Health Services could be, put together in a way that would be useful. I think we were highly successful as far as like the number of cases and the number of deaths as, brought back to the population of Wisconsin is concerned. But unfortunately, although our research in mid-April was shown that there was a wide support for everything, that was prone as protective behaviors in the state, was bipartisans, and we had actually support from every spectrum of the political aisle. This is not the case anymore, and that this became an extremely politicized issue in Wisconsin, with the Supreme Court of Wisconsin, suing the state government and so on. So this really actually, going back to what Matt was saying at the beginning, this is a very complex issue where actually all the players at play here really, go way beyond, let's say, Marina. Maybe South Africa has not reached that yet, but as soon as, you enter the politicized level of this pandemic, it's more and more crucial, I would say, to remember that this is not just a life science issue. At the end of the day, I think social sciences have more actually to say and more potential expertise to help navigate those waters than a pure, let's say, bench science approach that may actually forget that at the end of the day, this is not just a hard science issue, but it's really a complicated, wicked issues for all of us to attain. I'll stop here, so I want to make sure
Very
we have
good.
time
Thank
for
you.
questions.
Actually, we started with Matt referring to the COVID-19 situation as a wicked problem, and you've now again insisted on the complexity and the multidisciplinarity that requires. First of all, I mean, how accommodating or how welcoming are the life scientists are to your interventions as social scientists and to your colleagues, and how aware do you think and how accepting are the public representatives through the municipalities of the complexity and all the layers and dimensions of the question?
This is a great question, Brian, and I think this will depend from context to context. And I think really, let's remember the United States is a union of states, and you cannot compare Wisconsin to Texas, to Maine, to California, not only at first of size, but also as far as who are the trusted actors. I mean, University of Wisconsin-Madison is a very trusted institution in this state. And we have, although there may be like some issues as far as we consider the elite and so on, but at least from the leadership, you know, at the local level and so on, we have forged very strong relationships. We have something that's called the University Alliance, which means that the courses at University of Wisconsin have been working for a number of years with local municipalities to actually answer their questions that they could implement in their community. On the life sciences side, we know we have a strong, you know, history of interdisciplinarity. Wisconsin has a number of centers where you have actually a number of disciplines that are attached. So I would say, you know, the people that are participating in this project are the ones that are open to this kind of thing. And certainly the Department of Health Services is welcoming any help they can get. So I think it will depend of each state, each context, each country, each university and so on. Obviously not all life scientists, you know, accepting of social science. I would say the vice versa. Everybody lives in the little paradigm and has a hard time understanding the other side, but you always find people that are working, willing to work together.
Very good. Thank you, Dominique. We could come back across the oceans to Italy, to Massimiliano Bucchi from the University of Trento, a writer and author on science communication and on sociology of science. Massimiliano, you've been associated with 2 surveys of public attitudes to COVID-19 in Italy, but you've been looking at surveys from other countries. How do you see the evolution of the public perception of COVID-19?
Yes, we did 2 waves of a survey of public perception of COVID, early March and early April. We actually managed to interview. I will share my screen very, very briefly. We managed to re-interview about 800 participants to the first wave. Oops, sorry. And this is a quite remarkable change that we observed between March and April, particularly with regard to the perception of the risk, which about 1/5 of Italians still undermined. Can you see the slide?
Well, I can. I hope that everybody else can.
Okay. So in the beginning of March, the first Italian case was around the 20th of February. So at the beginning of March, still 1/5 of Italians were thinking this is not very serious, and this changed remarkably in April, and pandemic had become a general concern for almost everybody. We also focused, and this is the second point I want to make, on the role of communication and sources. And one thing that, for example, also our colleagues in Sweden found, which did the first wave about the same time, a few days after ours, I think, is that traditional media, TV and radio, played a very important role. Institutional media played a very important role when we asked people, where are you looking for information about COVID? Social media, and you see the role of social media also was further reduced between March and April, but it was already quite limited, about 7% of the respondents. And the same thing when you ask about trust in information sources. So it is mostly indication from national and local institutions. And actually, I don't have the time here, but we found something very, very similar in Italy when we were looking for sources of information, for example, about vaccination, that when it comes to actually taking decisions, for example, like vaccinating your child, then the role of social media becomes much smaller than we tend to think. Last point I want, well, actually it's two connected points about the role of science, which I think is something quite important for many of us. What is the perception of the role of science in such an emergency? And here is the answer to the expectations. So actually, the question of hype, or the perception of science as hype that Matt was mentioning with regard to the narrative, dominant narrative in American politics, is not very strong in Italy. You see, there's about three-fourths of Italians have great expectations, but they think science, they have an understanding, or at least an idea of science taking quite long to produce results. More critical, so there is trust, confidence, expectation, but not expectation of quick fix and solutions, apparently. A more critical problem arises when we asked about, which is a point that Marina addressed in a very interesting way by looking at the case of this South African scientist, about the role of experts. I think in Italy, we witnessed, as in many countries, a prominence and a variety of, and the presence of science experts in the media that we have never seen to this extent. And the result, according to the responses that we got, was a little bit of confusion. So about half of the Italian population perceive this polyphony of experts as a bit confusing, while on the other hand, 1/3 thought their performance as public communication was quite good, clear and effective. Another interesting position is the 11% who say it would be better if science experts gave their advice to institutions confidentially, not publicly. This for me is a very interesting point. Again, I don't have the time, but I think there is sometimes a mix-up in the media. Is the scientist speaking as a scientist, or is speaking as a scientist advising the public institutions? This might have different consequences on the perception of what they say. And finally, there is 8% thinking scientific experts are competent but unable. So they judge negatively, but mostly focusing on the communicative performance. So these are the main points I wanted to make based on our data. And as I said, some of these findings are resonating with findings from other countries, particularly European countries. We have been in touch and posing similar questions, and hopefully we will have further opportunities for cooperation with studies conducted in other countries.
Could you remove the share screen? But just on the last slide there, where the 47.8% said that diverse opinions from experts cause confusion, is there, without getting into the detailed methodology, was the word confusion contained in the question? And is there another way of asking the question that would give us some sense as to how open members of the public are to this complexity we've been talking about in all of the contributions so far today?
Well, first answer is yes. Confusion was one of the options, one of the 5 options that were possible to the respondents. Well, of course, I mean, we know the potential and limits of service, so of course there would be a variety of impressions that you could, but the reason why we ask these questions and the way we ask this way is that this was a quite important point in the Italian policy and media debate. What happens when, as it happened from the very first time, there is a disagreement among science experts happening in public? What are the consequences? So we wanted to address this question. Then, of course, respondents, as you saw, they had the option of saying there were many experts, but they were perfectly clear. So I wasn't confused by Then, of course, your question is very. I think we would need probably different methodologies to say. Is this related to the fact that the people who say I'm not confused understand the fact that diversity of advice or diversity of statements doesn't mean that science doesn't have clear ideas, for example? That, of course, we don't know. It's hard to tell from a survey.
Sure. We better move on. And before I do introduce the next speaker, can I just draw attenders' attention to the Q&As? There are quite a few entries there, and time is marching on, and we will probably just need to select one or two. So you can, within Q&A, you can indicate a like for a certain question or questions. So it would be helpful if you could look down through the questions and maybe help us select a couple that we will come back to. But we're now moving to another part of Italy, to Bologna, to Anwesha Chakraborty, who, as the name suggests, is not indeed from Italy, but indeed she's from India, and she's been looking at both Italian and Indian media in relation to COVID-19, and specifically in relation to India, looking at the mix of scientific information and then unscientific claims or pseudoscientific claims. So how has that been seen? How have you seen that balancing out during the COVID-19 coverage in recent months, Anwesha?
Okay, perfect. Can you hear me?
Yes,
okay.
I hear you.
Well, okay, perfect. So yes, thank you very much for this opportunity to share some news and insights from India while sitting here in Bologna, not very far away from Trento, having experienced many of the things that Professor Bucchi just mentioned. As of today, 26th, India is in the 4th phase of its lockdown and is the 10th most affected country in terms of infections as per latest data on Worldometer. But of course, with a very low death rate at about 4,000 people have lost their lives, with about over 130,000 cases. The lockdown measures came in early in India. Already in the first week of March, the country had closed its borders to travelers from multiple countries as early cases started getting reported. This was followed by a people's curfew on the 22nd of March, which was a precursor to a 21-day nationwide lockdown announced by Prime Minister Narendra Modi 2 days later, which has since been extended 3 times, albeit with reduced restrictions in each successive phase. It must also be noted here that when the nationwide lockdown was announced on the 24th of March, the number of reported new cases daily was still in the low double digits, 37 as per data on Worldometer for that day. Modi, who enjoys very high approval ratings amongst his electorate, and that rating has only become stronger at about 80 to 90%, which is crazy high since the lockdown began, has also been actually one of the primary expert communicators during this period, infusing science, technology, mythology, and culture in his televised addresses to the nation and in his hugely popular monthly radio program, Man Ki Baat, which roughly translates to Inner Thoughts. His March address is a prime example of this. Using mythology, he conveyed the seriousness of the disease and the need to stay home and restrict movements, acknowledging the hardships, especially of the poor because of the lockdown. He defended the government's decision to implement the strict lockdown so early, saying that Indian traditional wisdom suggests that an illness and its scourge should be nipped in the bud itself. Furthermore, in his April address, he reasserted the importance of India's ancient traditions such as yoga and Ayurveda, which he said are important measures to boost immunity. He also exhorted the people to follow the guidelines issued by Ayush Ministry, which was created specifically to promote traditional schools of medicine and wellness, and propagated the widespread use of masks. In this particular speech, the Prime Minister also lauded India's efforts in distributing the anti-malarial drug hydroxychloroquine to the world, which also, of course, happens to be Trump's favorite drug, and more importantly, which as of yesterday has been suspended by the WHO from clinical trials. Some of the other figures of authority emerging during the pandemic, at least in terms of news coverage, which I've been following, are WHO, ICMR, or the Indian Council of Medical Research, and the Ministry of Health, Government of India. The national media has been carrying articles referring to these entities in some permutation and combination nearly every day. Media has also shed light on the state of Kerala, which has handled the pandemic really well, and it has lauded its grassroots public health communication networks, with special praise reserved for its health minister, Shailaja. At the same time, social media has seen a rise of nationalistic content. This includes TikTok videos, which show how India succeeded in containing the spread while many countries of the developed world failed to do so. Of course, these are very premature videos made already in March. Perhaps some of the more unscientific and pseudoscientific material, at least as far as this initial phase is concerned, has been and is being communicated via WhatsApp, which is the most popular messaging app in India. Fake news regarding apparently successful vaccine trials or guidelines from the Indian Council of Medical Research have been circulating widely. Perhaps some of the most creative instances of such information could be traced back to the Prime Minister's call to light candles and flashlights, kind of like they did in Italy, to show gratitude to healthcare workers, which happened on the 5th of April at 9 p.m. Indian time. Some of the WhatsApp forwards said that lighting candles will kill the virus and hence it's a masterstroke. There were some even more creative claims saying that the torch of the smartphones will create a magnetic field, and this field will then attract the virus, and that's how the virus will die. And that's how India will overpower the virus. There were also numerological analyses done regarding the significance of carrying out the exercise at 9 p.m. on the 5th of April, which adds up to 5 plus 4, 4 of April, of course, which equals 9. 9 is also the number associated with Mars, which in Hindi and in many Indic languages is called Mangal or wellness. As an aside, I've also put my mother and some of my friends as my data collectors in this period, since I'm far away and collecting these WhatsApp forwards. Overall, just to end, however, it can be said with a sufficient level of certainty that science, and more specifically health communication, has taken center stage in the media and in the lives of people who have access to this media, of course. India still has not reached the peak of infections, which is supposed to be around June or July. So it is understandable that the narrative in the media hasn't yet completely shifted from the medical and health aspects to primarily the socioeconomic aspects, as we see, for example, in Italy, which is the other country that I'm following. And that's it from my side. Thank you very much.
Thank you, Anwesha. Does India have a very high-profile public scientist, similar to Karim in South Africa, who can go into bat, if I could use a cricket analogy for India, go into bat against pseudoscientific and unscientific claims?
Well, interestingly, at least from what I've been observing, and probably it's the only country where the Prime Minister has assumed the role of the primary science or health communicator, as it were, in this period. But it's still early stages in India, as far as India is concerned. So let's see how things will turn out. But yeah, he's the biggest star. He's bigger than Bollywood or cricket stars, for that matter, at this point.
Okay, thank you very much. We're very close to the hour, and although I said at the very beginning we would keep to the hour, There are very interesting questions coming in, and we just haven't managed the time as well as we could have or should have, and we're going to run a little bit longer. We hope that isn't a problem for people if we run over the hour to take some questions from the attenders. However, if we don't get to all of them, and we won't, we will forward them to the speakers to whom they're directed, and hope that they can answer them directly by email or by other means at a later time. So they're not forgotten. But I'll move now finally to, among our panelists, to Barbara Gormley in Dublin, the same country as I'm in, but a couple of 100 kilometers up the road. And she was already working as a PhD researcher on pandemics when COVID-19 came along. In fact, she'd been looking at the swine flu pandemic of a decade ago. And so now she's looking at the differences in how these two pandemics have been handled. And what are you finding out, Barbara?
Well, it's probably a really good idea for us to address the differences between what happened in 2009 during the pandemic, swine flu H1N1 pandemic, and what's happening now. And just to explain a few differences, because I feel that they actually inform what's happening at the moment. So there's a lot of connection between the responses that happened during 2009 and the responses that are happening now. So what I'm asked regularly is, why don't we have the social distancing? Why don't we have restrictions on travel, etc.? Why didn't we have that in 2009? So three main differences that would explain that is the 2009 H1N1 pandemic started in Mexico in May, and basically by a couple of weeks later, it had been elevated to the level of a pandemic 6 pandemic by the World Health Organization. So the level is important here, because at the time it was based on geographical spread, severity of causative illness, and also morbidity rates. And unfortunately, the H1N1 pandemic is now referred to the pandemic that never happened. Because they started to realize about 2 months in that it wasn't going to cause the numbers that were actually predicted by modelers, which would have been something in the range of the Spanish flu of 1918. And also the pandemic very much peaked very quickly. They also had, which vitally important, which please God we will have, but we don't have yet, they had a vaccine in the pipeline as they were able to tweak an existing vaccine, and countries then began to put in orders for those vaccines very quickly at huge costs. And when the pandemic peaked, which happened during the summer season, the vaccine wasn't available until November of 2009. So a lot of the vaccine wasn't used, and you had a lot of returning of vaccines, etc. So they're the main two reasons that I would say that the differences between the two and what's happening now, and why we didn't see that those levels of responses are mainly down to the fact that they had a vaccine, and they also had antivirals, importantly, to deal with the symptoms. They were namely Tamiflu and Resalin. So another difference that we would have saw in 2009 was the target morbidity group, and these tended to be the same group as would be vulnerable during the flu season. However, outside of that, you were having young people with underlying illnesses dying, and also pregnant women. So that would have been one of the differences as well between COVID-19 and it. And one of the things that kind of developed from certainly from what we're seeing now in cocooning and protecting older people, at the time the Australians decided to include, along with, say, an example, mitigation phases or contagion phases, they added a protection phase. And that's very much carried over now into what we see around cocooning, etc. Social media point of view, we have our expert sources facing loads of challenges at the moment around disinformation, misinformation, and conflicts of interest. In 2009, Twitter was at its infancy. Now it has 330 million followers. So lots of opportunity to amplify your good science out there, but also loads of opportunities to amplify misinformation, etc. So what trends that I'm noticing at the moment, I'm collecting an awful lot of data from Twitter, and trends that I'm noting at the moment are that you have a lot of expert sources like epidemiologists and virologists, and I know we talked about them becoming like overnight celebrities due to COVID-19, but they're very much taking it upon themselves to address misinformation and disinformation, almost in a role of policing Twitter, and very directly calling people out, especially in relation to maybe experts that say you have be an epidemiologist, but you're not operating in the infectious disease area. Who are, everybody at the moment is wanting a piece of the COVID-19 pie. So you have a lot of crossover from experts where it's not just exactly their area, and they're quite willing, expert scientists sources are quite willing to call that out directly on Twitter. What we're seeing as well is a huge access to scientists that we've never seen before, and you're getting epidemiologists, virologists, saying, Q&As, I've got an hour here to, and I can answer anybody's question, etc. So a lot of engaging with the public. Another finding that I find very unusual is during the swine flu pandemic in 2009, the focus of, say, any kind of communication campaign at the time tended to be the person in the white coat with the qualifications. And at the moment, we're seeing that politicians are front and centre. Now, that could possibly be explained away by the fact that it's a global health emergency crisis, but it's usually the job of the CMO, Chief Medical Officer in the country, to kind of put across scientific findings, etc. And what I'm finding is you're getting big personalities, politicians such as Boris Johnson, Trump, etc., getting involved in the science when really they have spent most of COVID-19 ignoring what the scientists have said. And you're getting quite a lot of backlash on Twitter, etc., because that's one area that I'm very focused on, just because it enables me to see the different players in the dissemination process. And also from an Irish point of view, I have since the beginning of my thesis been trying to argue that there is a case for a deficit model during a very unique, evolving circumstance like COVID-19. And the deficit model basically being the top-down information from the Chief Medical Officer, because we know that people look to relay their fears and also gain instruction, and they want instruction, especially in the first stages of the communication process, the first waves that you would associate with a serious health emergency such as a pandemic. But what we're also seeing now as well, which is quite evident in policy change and also backlash from the public, etc., is which I'm very, very happy to see, which is a lot of engagement. So I know that they have said on several occasions here in Ireland that they're using market research and they're taking polls to enable them to see probably the effects that the restrictive measures, etc., and reopening schools and, lifting of lockdown procedures, etc., how that's affecting the public. And I know they're using market research for that purpose. So what I feel I'm seeing now is a hybrid approach to science communication, where we have on one hand the CMO, Chief Medical Officer, giving the top-down information, and on the other hand politicians addressing the situations that we're in at the moment. I hope that suffices.
Okay, Barbara, thank you very much indeed. It'd be interesting to see from other people's responses whether what you've observed in Ireland is replicated elsewhere in terms of the learning from 29 forward to 2020, and indeed the use of public opinion polling and other methods to inform the authoritative messages that are being delivered by Chief Medical Officer and similar persons. I'm going to try and go back now and pick up some questions, including questions that were addressed to Matt arising from his contribution at the opening. As I'm somewhat new to this, not to say entirely new to this, I'm a bit out of my depth with all the very many questions, and I'm not quite sure how to pick one up.
There was
maybe, yes.
Brian, could I ask all the panelists to turn on their video? I've unmuted you all. And I noticed that Dominique has said she would like to answer one question live, which was Toss Gascoigne's question about the Australian approach was to create a national cabinet with state premiers joining the cabinet of national government. This involved politicians from both major parties and depoliticise the health aspects of the issue. So Dominique, you can answer that live.
Oh, no. Well, the thing is, like, you know, like the interesting thing is that, and I go back to Matt at the beginning, you know, like when he was drawing parallels with climate change, how long can you depoliticize any scientific issue? And is it actually, you know, like reasonable to think we can? Because at the end of the day, whenever you will have to make a public policy decision, that will involve, you know, political, you know, decision making. So I think we are kind of like, you know, and maybe the Australians are better than, you know, at doing this. But at the end of the day, to realize that all the scientific discipline may be providing their expertise with whatever data they have from their side of but at the end of the day, there will be a political discussion and a compromise because there's going to be public policy that will be decided. So I think we kind of like, you know, like lying to ourselves is we thinking of those pandemic as pure scientific issues. They will end up, you know, involving public policy decision and political debates and compromise.
Matt, have you been able to see the questions that are directed to you?
Yeah, sure. I was going to address a couple quickly. I think, I mean, on the idea of politicization, one of the reasons why you know, the U.S. was caught off guard by the pandemic is that the pandemic was never easily politicized. So it's always been a discussion among a certain sector of intellectuals and experts and kind of administrative agencies, public health agencies, with no real spillover into Congress or the White House. There was some effort both by the Bush administration and by the Obama administration to invest in greater pandemic preparation, but there was never a political constituency for the issue. There was never a set of interest groups or a lobby on behalf of preparation. And the parallels to climate change are interesting because what we've seen over the last couple of years is a transition from talking about climate change to talking about the climate emergency, where climate change became this totalizing paradigm. All of the world could be interpreted through the lens of this climate emergency. As Naomi Klein writes in her book, Climate Change, This Changes Everything. And, you know, the use of modeling 30, 50, 70 years out to predict things like, you know, millions of deaths and specific types of impacts. But what you're seeing is that blinds us then to many of the other risks that we face in society. And, you know, while we were talking about the climate emergency, no one was talking about a pandemic emergency. And now we're thrown into this new state of sort of radical uncertainty. It kind of underlines the kind of the radical uncertainty of history and political and health and environmental systems. And it's all, you know, so it's very difficult to say, you know, what's going to happen in the future. But now we suddenly realize that pandemics are the new normal, that all this discussion around a climate emergency and our ability to model what the world will look like 30, 50, 70, 100 years from now, none of that modeling took into account, for example, the idea of, you know, the increasing transmission of animals to humans of various types of viruses that will have worldwide impacts and change the way that we live and the way that we work and the way that we travel in almost every institution in society. So in many ways, as real of a threat and a serious a threat as climate change has been, it is a product of politicization on the left and on the right, but particularly in this case, the politicization by the left blinded us to these other realities of the world, where it leaves us vulnerable now to what we're facing from pandemics. And what's interesting to me, I'm writing a piece for Issues in Science and Technology about this, is that even after the pandemic hit, in a matter of several weeks, everything about society was radically changed. And we're not going back to what we think about as normal. Even so, the climate advocacy community has not changed at all its policy proposals or its arguments or its rhetoric. The only thing that's changed is saying, well, the pandemic, see, we were right. The pandemic means that we were right because the pandemic is just a sign of what we face from climate change. It's the same proposal as the Green New Deal, and now they're trying to universalize and go worldwide with the Green New Deal. And part of that is right. We need more investment in the public sector, and we need to pay closer attention to inequality and healthcare. But at the same time, you have to now talk about it in different ways, and you have to adapt to these new realities where pandemics will be the central feature of political discussion for a decade. Yeah. Because this risk is not going away, and at the same time, we're gonna more easily more comfortably live with the threat of risk. If this is endemic to our life now, right? A vaccine is not going to solve this, right? We're going to think about risk in different ways. We've lived in the safest, most protected world in history, and now we're going to think about risk in slightly different ways. And I think in some ways, it will habituate us in some ways or change the way we think about the risk of climate change, maybe for the better. But I think the last thing is, well, it also shows the limits of science and innovation, right? So this idea that science and innovation will solve climate change has also been a dominant theme. And now we're seeing the limits of science and innovation in dealing with a pandemic, which is a wicked problem, but also potentially simpler and less complex than the super wicked nature of climate change. So there are no easy solutions, and we're living in a world of radical uncertainty. And I think the more that we think simplistically and sometimes dogmatically, the greater risk that it puts us in.
Okay, we're going to wrap this up in a few minutes. Thank you very much indeed, Matt. And we look forward to your several writings on the subject in the near future. But I think, Jenny, you're going to put a question to Marina?
Yes, this is a question that Marina did answer privately, but a lot of people like the question. And it was one that Anne Grand asked, which was that, do you think the creation of a scientific celebrity that is perceived as speaking for a particular vision and lending it credibility precludes them discussing the uncertainty that is inherent in science?
Okay, Jenny, yes, thank you for that question. I certainly don't think that because you're a celebrity scientist, you shouldn't speak about uncertainty. In fact, quite the opposite. I think having a high profile comes with an extra responsibility to make it clear that we are dealing with a very high level of uncertainty. We're dealing with a virus that is novel. We are giving advice in the absence of, solid peer-reviewed evidence. And I hope that some of the examples I gave of Professor Abdool Karim actually illustrated that he himself emphasizes the uncertainty and the nature of uncertainty. Of course, it could be that not all celebrity or very high-profile scientists would do that, but I think all of us as scholars in the field also have a responsibility to emphasize uncertainty and the tentative nature of the advice that we give. I would like to add just one thing, like literally one sentence, responding maybe to Dominique and this issue of politicization of the issue. I hope that by giving the example of a specific scientist, I did not create the impression, I did not mean to in any case, to say that it's only a health science problem. The whole COVID-19 pandemic is hugely politicized in South Africa. It has been since day one. And it's becoming intensely, acutely, almost painfully politicized by the day. And I think also in South Africa, we've seen a cry go out almost from the social scientists to ask to be heard and to ask to be recognized for the advice that they can give as social scientists across many different disciplines. So I agree 100%, this is a wicked problem. This is not a problem for one single discipline. And we also as science communication scholars have a platform and an opportunity now to make people aware of the advice that we can give and linking, very importantly, research and practice. Now is the time when our research ideas and our theory must really translate to practical advice on how people should communicate, how people should engage, how to take the debate forward constructively without it becoming just a theoretical exercise.
Well, I'm inclined to take that as a very good wrap-up statement and suggest that indeed is what we need to be talking about between now and this time next year, but certainly when we meet in PCST 2020+1 in Aberdeen in a year's time. We have been recording. We will make the recording available. We'll gather together the questions. Many of them actually overlapped with each other, as attenders can also see. But we'll try and find ways of answering for the speakers to answer the questions that haven't been directly addressed in the coming days and weeks. We've managed to keep 130 participants. Thank you very much. I know it's not easy to follow something sitting looking at a screen for over an hour, so we appreciate that. Huge thanks to Jenny Metcalf for all that she did to make this possible. Depending on your feedback, we will possibly run several more of these webinars as a part of the build up to our next face-to-face conference in a year's time. Thank you particularly though to the speakers, Barbara, Anwesha, Massimiliano, Dominique, Marina, Matt, and who have I forgotten? No, it's done. So at 3 o'clock in the afternoon, whatever time it is with you, good night, good morning, good afternoon, safe home if you're actually out of the home. Otherwise, safe over to the kitchen to get yourself a coffee. Bye.